Well, hello again. Jason Renault with AMSA Talks, and today I'm with Jeron Dorsey with the City of Evanston and the Evanston CARE program. Welcome.
Welcome. Thank you. Thank you. Thank you for having me, Jason. Excited to be here to talk to you today.
I'm glad to have you. Glad to have you be a member of AMSA. Jeron, why don't we start by you introducing yourself to folks and tell us a little bit about how you got in this position.
So, yeah, absolutely. So my name is Jeron Dorsey. Born and raised here in Evanston, Illinois. Lived here all my life. Kind of grew up here, going through all the different recreation department camps and activities here in Evanston. Started my career here with the Parks and Rec department about 11 years ago as a program supervisor. Then on went to be a program coordinator, a recreation manager, and then after about 10 years of being here with this department, I went off to the village of Lincolnwood to serve as their superintendent of parks and recreation. And then Evanston decided after many, many years of kind of preparing for the Evanston CARE team that they were going to officially launch an alternative to response to police program. And I was excited about the opportunity to come back to Evanston as the deputy director of Parks and Recreation to mainly oversee the CARE program, but also our Youth and Family Services Division, our Community Arts Division, as well as all of our department's community service initiatives. And so got a long career in Parks and Recreation, community services, and just wanted to be a part of this great initiative and the community that I was born and raised in.
Fantastic. So walk us through Evanston CARE and maybe start by explaining this is unusual. It's in the Parks and Recreation Department.
Correct. Yeah. So the CARE program, it is housed in the Park and Recreation Department, and so the ideal of this program started in about 2020, where there was committees convening together to determine how we can have a alternative response police program. And that committee convened of residents, city council members, and their primary focus was to focus on what a program like this would look like. That initial response led to another committee, which when our mayor, Daniel Biss, was appointed mayor here, he launched another committee called Reimagining Public Safety Committee. And one of his first resolutions was to develop this committee, and they focused more on like the funding, looking at our police department, looking into where a team like this could be of assistance to respond to low risk not low emergency police calls. And then from there, the city council authorized the city manager, Luke Stowe, to enter into an agreement with LEAPS organization, which is, I'm sure many of you all are familiar with. That's an organization, Law Enforcement Action Partners, which has been very, very helpful across the world on getting programs like this started. Based off their research and their data and looking at our CAD data and doing a year-long process of kind of figuring out how this program could be unique to our community, they came back with a recommendation that this program be housed in the Parks and Recreation
Hmm.
Department. And that's eventually how it landed here. And they provided a lot of the data to help us get up and going. And so very, very appreciative to both of those committees, as well as our city manager and Leaps as well.
Well, I didn't know that LEAP had been an instrumental part of the design of the program.
Absolutely, absolutely, and they continue to be. Their partnership is unwavering. They always check in with us and just kind of get an update on where we are, where we can make adjustments to. And so Lionel over there at Leap has been great.
Great. Glad to hear that. So walk us through Evanston CARE. Tell us about what you're doing, who's on the staff, what your outcomes are.
Yeah, so Evanston CARE, we launched our program on July 29th. So that was our first day responding to calls. So we're a little bit around the 4 month mark. We respond to 10 call types currently. Those call types, they range between nuisance complaints, check well-beings, panhandlers, vagrant, lost and confused persons, leaf blower violations, which is a real thing here in Evanston where we've got rid of gas leaf blower. You have to have electric. So if
Ah,
you use
good.
gas, there is a violation. City ordinance violation. miscellaneous public service, mental subjects, and soliciting complaints. So those are the 10 call types that we respond to. We have a team currently now of two teams with two responders on each team, so a total of four responders. And they work Monday through Sunday, 7 days a week from 11 a.m. to 8 p.m. And they're responding to all of those different call types, as well as, most importantly, building those community relationships and, getting out into the community centers and the downtown areas and just engaging with individuals to get the program more out there on the forefront.
Well, fantastic, fantastic. And this is so 4 months in.
Correct.
What sort of challenges you're finding that you didn't expect to find?
So some of the challenges is one is making sure that we prioritize the responders who are out there doing this work. When that comes to self-care, compensation, appreciation, and just making sure that they are not suffering from burnout. So we're a community of 78,000 individuals and four responders that's responding 7 days a week. That's
Yeah.
a pretty heavy lift. But also, I think that what we are trying to work through right now is making sure our responders are recognized as a first response, and designating them as such. Because early on, as we got into this work, we kind of didn't have a lot of local models that we can kind of model our program off.
Mm.
Of course, we got Chicago CARE, who was great when they're responding to more of the behavioral health and mental health realm, and we're responding to a little bit more broader range than that when it comes to call types. And then Skokie, which is our neighbor, they have a co-response program where they have an officer and a social worker go to calls together. So our program is very unique, and so some of the challenges is not having a network of individuals who that we can reach out to and just kind of bounce ideas off. And so running into Alternative Mobile Services Association was very great for us, because now we feel like we have a huge community of supporters, and we always have organizations that we can reach out to. Most recently, we've met with Rochester, New York through
Oh,
this
great.
partnership, and that was a great conversation.
Oh, Aaliyah is great. I'm glad you got to meet her.
Absolutely.
Terrific. And you spoke a little bit about the challenges of scheduling. Do you think you have more calls coming in than you can handle at this point?
I think we're still analyzing that. So in the 4 months, we are at about 700 call mark. And so, when you think about the day in and day out, some days may be 15, 20 calls, some days may be 5 to 3 calls. It all depends on the day, but just trying to use the data to guide us into the appropriate direction is what we want to do because the initial recommendation was that we hire 5 teams of 2. And what we didn't want to do is have to, start with a lot of people and then have to scale down. We'd rather start slow and kind of and scale up.
Good idea. How is your dispatch working? Are you using a dispatch system, or how are you dispatching folks?
Yeah, so our crisis responders are dispatched right through the 911 call dispatch center, and so they are directly on the police radios. They hear our calls, we hear their calls, and based off how we have it set up right now, there are disqualifiers to determine if the care team is appropriate response or if the police is appropriate response. What's unique about it, and what I think is kind of cool, is that our police department will get to a call and they would determine that the care may be a more appropriate response. They'll dispatch us in. When we arrive, they'll leave, and vice versa. If we get in a situation that we deem unsafe or just don't feel so comfortable about it, we have the police dispatch as well as the emergency button that we can press, and they know exactly where we are. So I think the partnership between your police department and the buy-in and the collaboration is very important to make the program truly successful, as well as elected officials and city management.
Well, tell me about your political operation in Evanston. Your mayor is a big supporter. You've got a lot of support at city council. Your chief is a supporter.
Yes, absolutely. So we have outright support from our city leadership to our mayor to our entire city council. Our whole organization is very excited and supportive of this. But not only that, our residents are very supportive of this. We do presentations at ward meetings and different things like this, and people are just at all about how Evanston was able to continue its progressive path of starting initiatives that are just starting to get going in other communities, and we already took off and are well on our way to a very successful future for this program.
You mentioned progressive. What tell us a little about the politics of Evanston. What is Evanston like? What size of a city? Where is it located?
Yeah, so
Politics.
yeah, so Evanston is located right outside of Chicago. So we border Chicago on our south side. We border another community called Skokie, as well as Wilmette, which is two other suburbs on our east west side. And so those communities are more of a smaller community. Evanston has a population of 78,000. Of course, Chicago is huge. But in terms of Evanston politics, Evanston is a very progressive city where we are not afraid to make bold moves. And even if we get it wrong, we know how to back up and retract and fix. But we're not afraid to take that leap. And I think this program is an example of that. And so far, the community has bought into it. We are fully funded in our budget this year. When we started last year, we started about halfway through the year, so we had just funds to get us through that first half of the year. But now our budget just passed with a fully funded budget for this program, and so we are getting new vehicles. So we're super excited about all of the changes that are being made.
That's great. That's great. Um, Last item, let's talk about your training. You have a unique, you mentioned that this program is unique, and it is in so many ways. You have a unique relationship with a local college, Oakton College. Tell us a little bit about that.
Yeah, so Oakton College, they deserve a lot of credit for preparing not only myself, who went through the certification program as well, but all of our responders speak very, very highly of the training that we received with Oakton College. And so originally, when the partnership with Oakton College came about, it was conversation amongst the provost and our department director here at the City of Evanston prior to me even coming back to the city. And it was a conversation revolved around how we can partner better on workforce development. That conversation led to Oakton finding out about what we were wanting to do with our crisis alternative response program.
Hmm.
And they came up with, well, how about we help you with the curriculum on that? And when I tell you, Jason, this process went very, very quick but thorough to the point where, they started meeting together. They started talking about curriculum. They started looking at other programs across the country. They started looking at what type of training and education crisis responders would need to be effective in their job. And from there, we looked up and they designed a certificate program that's currently being offered at Oakton College. And it's a crisis responder certificate program. And myself and the four other responders enrolled in Oakton College as students to undertake this 4 to 5 week course where we went through a bunch of training as far as, mediation, motivational interviewing, vicarious trauma, conflict resolution, de-escalation. And it was what was unique about it is we did a lot of role playing and the professor was very, very engaging. And so what we got from that process is we were all able to learn each other on a way deeper level by being vulnerable and sharing our past. Because our crisis responders, what we look for more than any education is a lived experience, someone that can relate to the individuals that we may encounter. So Oakton was integral in making sure that our training reflected the community that we were serving. So if we would have got this at another college that may have not been local to us, they wouldn't probably understand our local needs here and be able to collaborate with all the community partners to make this training what it was. It was phenomenal.
What a fantastic experience for the five of you to be in right at the beginning.
Absolutely.
Just to get to know each other in a completely different context from work, but also within the understanding that you're making something together.
Absolutely, absolutely. It was something that I think really molded our team to work well together and know how to bounce ideas and use each other where we're strong and weak at. We all learned that through our training at Oak.
Now, you had a special professor. Tell us a little bit about her.
So Dr. Wiggins was our professor, and her background deal primarily with, the topics that we needed to cover, like mental health and behavioral health and all of the good things that come with that. So she had a very extensive background as it relates to that. And she also had her lived experiences in terms of her family and friends and situations she's been in that she also shared with us. And then she brought other individuals who she's worked with in other educational settings that came in on days to pour more into us. And so I think if I take anything from the Open training, if any advice I can give is make sure that not only is the content engaging and interactive, but also make sure that that professor is deeply engaged in this work and shows that compassion through her teaching, because it made a tremendous difference in our experience there.
Fantastic. But well, best of luck to you, Jeron, and your team, and welcome to the Alternative Mobile Services Association.
Thank you so much, Jason. And I'm super happy to be a part of this organization, and can't wait to learn more about other communities and how we can best support each other in this work.
Good. Take care.
All right, have a good one. Bye bye.